Good evening and welcome back to the LRP Tower. My name is Don Clark. We are back with our second round of doctors. Actually, Dr. Harrison, this is really a third rounder that we've had with doctors today, because we started off the day with Dr. David Jenis from Las Vegas, who's a clinical psychologist. And there were some things that we talked about there that I want to get into here. But first, we got to introduce you to the Samurai Doctor. He is Dr. Glenn Harrison, and a higher calling. Good evening, sir.
Yes, good evening, sir. How are you today?
We are good. So here we are. We are getting into closer and closer to the fall. The reason I brought up Dr. Jenis, and I will get into the other things that we want to talk to in just a bit, but because of what has happened over the past couple of weeks regarding unemployment, regarding waivers for paying rent and for mortgage, you've got people that are unemployed. I've read over the past couple of weeks that the levels of depression and anxiety has grown exponentially over the past week, 2 weeks, even the month, because leading up to it, you've got people that are going, well, wait a minute, they're going to take this away and I still don't have a job. Where are we as far as, now we talked this morning with Dr. Jenis about different types of help that his clinic gives, but I know that we talked a little bit about this a while ago, but when you're dealing with anxiety and you're dealing with depression, what is recommended? What is the best route that we can talk about here?
Well, we're cannabis based, so if we want to talk about cannabis, we can. But I think I think what we need to do is look a little bit more comprehensively. Cannabis is a tool, along with other thare one of the best things that you can do to alleviate depression is actually taking a walk in the sunlight. It's the normal things that are our normal habits, our normal endeavors. Getting back to them is actually a sign of health. Having the capacity to enjoy yourself and enjoy other people. A clinical stigmata of depression, but it wards off depression also. So all those lifestyle things come in, and cannabis is a lifestyle choice. I've said it before, cannabis is probably a little better for anxiety than it is for depression, but it can be used in depression, depending on what the modus is, what the rationale for your depression is. If it's from a somatic source, pain, inability, disability, etc., that can be alleviated to some degree with a significant increase as far as just your overall affect and your ability to cope. But make no doubt about it, your head and your body are connected, and there is a mind-body connection that reveals itself in the diseases that present as we go through these psychological changes. Depression itself is noted with a decided correlation with malignancies. So all of these things play in, and there is no one cure, there is no panacea, but there are things that can dovetail together in order to make for a better experience, a better life, and a better affect.
I wanted to know if you had noticed an uptick in that area also with any of the patients that you deal with. I know you can't get into detail, but as we, and because there's a number of different anxieties that are being caused at this time of year. You're dealing with the job front, you're dealing with the money front on a smaller scale, but to some people, a very high scale of the fact that you find out that there's not going to be any sports this year. And it does become a little bit of to some people, oh, it's not that big of a deal. Yeah, it is. It depends upon your lifestyle and depends upon what you go after. You're also looking at I noticed it just again today that the sun comes up just a little bit later, and that becomes an anxiety button also. So yeah, I can see where it does, create a bigger issue as we get into August.
Yeah. My significant other is a Alabama fan, Roll Tide. And nowadays, There's no Pac-10. There's no Pac-12. None of them are going to play. And you have to imagine that who are these guys going to play? And those football games get 100,000 people. Let's not even talk about the tailgating. We're talking about a radical change in life for many people as we go through this pandemic. Things that we did not anticipate. We did not anticipate this bleeding over into the year, and it sure looks like it will. But it's all fear-based also.
Ooh,
And
yeah.
fear, anxiety will definitely lower your immune system through its presence through corticosteroids, which are elucidated by the body in response to that fear, that uncertainty, yeah. I hope I said that.
No, you did. And I will say this, on a very conservative level, I ran the numbers for just the Big Ten.
Yes.
And what is, I ran the numbers on Michigan only, using the Big House as the litmus test for this. And if they're not dealing with anxiety now, they will be very, very soon. So this is definitely, as I thought about that this morning, I didn't want to dwell on it really long because I thought that might be a really good topic for down the road, but definitely something that is worth chatting about. Dr. Harrison will send over some information every once in a while as we get ready to do the show, and gives me a chance to chat with him prior to, obviously, about what we're going to talk about. And he sent over some information on a book that I became aware of back in the 70s by an author by the name of Lester Grinspoon, on Marijuana Reconsidered. And I wanted to get into that a little bit first. I have brought up this book on a number of occasions with not only some family members, but friends. And they said, well, can you tell me more about the book? And I said, I would love to, but I read it in 1978. So, but what I do remember the most about it is this was a book that was written in the early 70s, 1971, I believe, when it was just becoming a little bit, the idea of working with cannabis as a tool, so to speak, really started coming more to the forefront. And the fact that it was updated again, there's a lot of powerful information inside this book.
Yeah. But I think the power in the book relates to Dr. Grinspoon's journey, because it was personal for him. It affected him directly. The nidus of his interest as far as cannabis was based around his son, who came down with a form of leukemia, and through the course of his treatment found relief in utilizing cannabis, and it revolutionized his thought, because he wanted to disprove it to his son and to his family, even though in the face of getting positive results. Typically, he would go. His son would go for chemotherapy, come back racked with nausea, vomiting, and utilize cannabis in order to hold down food, to decrease his dysphoria, and it helped him. And so his father looked at cannabis and all of its different manifestations, its history, and came to a conclusion that it was a worthy agent to be included within our pharmacopoeia, and that we needed to study it more. And it made an impression upon me then, and it makes an impression upon me now, because my motto is that nobody comes through cannabis but through tragedy. At least that was my journey. Everybody that I knew, that I loved, that was significant in my life, passed because of cancer. And cancer is a horrible thing. We were talking earlier about pancreatic cancer. My father had pancreatic cancer. And he didn't know that he had pancreatic cancer until it was much, much later. And he was racked with intractable pain. And obviously that was very, very concerning. I didn't have the knowledge at that point that I do now, but if I did, I would have changed his armamentarium. I would have changed his medications. I definitely would have included him, because the studies that we've seen in the short term, at least, have all been very, very supportive, especially in that regard. Pancreatic cancer is a bad one because it presents late and people don't live from it. median lifespan of a patient with pancreatic cancer is someone on the verge of 6 weeks. You don't have a lot of time. But if you are going to succumb, it would be better to do so in comfort rather than in intractable pain and really kind of zoned out because of the pain medications. So for me, and looking back in my history, whether it was my uncle who died of lung cancer or my mother who died of breast cancer, over the years, what we've seen are applications and newfound capabilities of cannabis and cannabinoids that help in that regard and show very, very interesting capabilities. And so much so that the drug companies are now trying to pull it all apart to find what is the magic bullet. They're always looking for a magic bullet, but the magic bullet is in the plant.
This is, it's a higher calling with the Samurai Doctor, Dr. Glenn Harrison. And I want to get back to the book in a little bit, but I want to keep talking a little bit about pancreatic cancer because that is it's a commonality that you and I have. You lost your father from it. I lost my brother from it.
Yeah.
I know that at the time when Bob when he had it, or what he thought was, there was obviously there was a problem. When he was living in Moscow at the time, came back, and he was diagnosed with it here in the States, but it was far too long. There are some, and I remember Bob telling me, "Don't tell me the odds, don't tell me the odds on this. Just we're going to go down to Houston, we're going to go to MD Anderson, and we're going to do the best we can with this." But you sent some information along that was a very interesting read about a study that was recently done at Harvard. Can we talk about that a little bit?
Yeah, it was done at the Deaconess in Beth Israel. I'm sorry, it was done at no, it was done at Harvard. My mistake. And it was a study that principally looked at a component of a cannabis plant, not so much the cannabinoid that we look at typically, which would be your CBD or your THC or CBN or any of the other cannabinoids or even the terpenes. No, these were flavonoids, and flavonoids are different compounds made by many, many plants that we look towards for beneficial use. It pretty much started when we started taking a look at the Mediterranean diet. One particular flavonoid is what we call resveratrol, and you find that in red grapes. And it had particular antioxidant and anti-inflammatory responses that we think are essential as far as preventing vascular disease. The question was, why is it the Italians? Why is it the French? They don't die of heart attacks and strokes. They're eating just as fatty meals as we are. What is different about their diet? And it came down to other condiments and other spices, and particularly red wine. These flavonoids are pigments. You'll find them ubiquitously in fruits and vegetables, and the ones that have the most are the ones that stain your finger. Your blueberries, your strawberries, your raspberries, your cherries, your beets. You find excessive flavonoid content in your green leafy vegetables. And all of them have noted effects and were found in this particular study to have effects against pancreatic cancer, just the flavonoids themselves. Now, we know that CBD has effects against tumor cells, but cancer is a myriad of diseases. It's not just one. It depends on the cell type and what they're presenting to you. And in many instances, these cancers actually present CB1 and CB2 receptors. So you can use CBD on them and actually achieve results. And there are case studies of people with lung cancer that was at far an extent, and they started CBD with progression. So it's not just one agent. It's not just this or that. It's the entire compendium of the plant. The plant is a factory, and that factory makes items which bring you back to what we call homeostasis, brings you back to balance. The mechanism by which cancer cells are killed via cannabinoids is a process we call apoptosis, which means that the cell's involute. It's autophagocytic. The cells are taken up by the body without any debris or without any toxicity. They just regress. They just involute. And This has brought about tremendous study all around the world. Remember, we can't do a lot of studies here in the United States, principally because cannabis is a class 1 drug and you can't get any federal funding. And if there isn't any federal funding, you don't do any research. But Italy, Japan, Spain, France, they've all studied these chemicals, these proponents of cannabis, and they found tremendous results. So we're a little bit behind the curve because we should have incorporated all of this about 10 years ago as far as our treatment regimen. But we're getting there, and that's really the purpose of the show, to enlighten people. You know, if you go to some cancer centers, if you go to Dana-Farber up at Harvard, they have a physician on staff that is an integrative internist who deals as far as cannabis is concerned. Why? Because why would they give you 5 or 6 medications in a pill which will have varying effects and probable some cross reactions when you could be treated with cannabis for all the things that they believe you're going to have, whether it's pain or nausea or anorexia or insomnia. All these things plague patients with cancer, principally because they're stressed out. You get a diagnosis of cancer, it will change your life the moment that you get the diagnosis.
I guess that's, you know, one of the things that I look at with the study that was done. I mean, when you talk about, I mentioned MD Anderson in Houston, living in Massachusetts for years, I'm well aware of the work that was done at Dana-Farber and the amount of people that are working there. When you talk about where marijuana is on a national level today, a common sense thinking on my part would be, we're seeing slowed tumor growth with pancreatic cancer with this report. Maybe we need to, I know there's so many other things that are important today in the world, but maybe this is to people that have been affected by cancer, specifically pancreatic, maybe we need to go back and take another look at this and turn this around a little bit and move a little faster on this, because now we're starting to see something here. And it's coming from a number of different areas, but more importantly, it's coming from the good folks in Harvard at Dana-Farber.
It's coming from a lot of places, but now they're on board. And that's the important thing. And once they lend their name to such, now their pedigree is there, and people say, why does it take that? I'm not quite sure, but it does. And it happens. They have clout. There's no doubt about that. We need to step it up. We really do. And the rationale is, what's the toxicity? What, you're going to be high? Really?
Right.
And in many preparations, that's not even really going to be the issue. The interesting thing is, however, is that when you're talking about flavonoids and you're talking about those other components of cannabis, they can be extremely variable from strain to strain. And certain strains will have better efficacy against some tumor types as opposed to others. For example, if you were looking at a prostate cancer, I'd be looking for a strain of cannabis that is high in THC. Why? Because anandamide, or THC, was found to be effective in vitro as far in the test tube, but as far as stunting or regressing pancreatic tumor cells. Now, you compare that with breast cancer, it's the opposite. You'd be much more want to use strains that were lower in THC and higher in CBD. So we're looking at indicas and indica hybrids for pancreatic or breast cancer, as opposed to sativas or sativa hybrids as far as prostate cancer. Then you look in your different preparations. What would be the best preparation to give for one person for one type of cancer or the other? And then there's a question of, if I use one strain, from 2 different places, am I really using the same strain? And the answer is probably no, because cannabis is what we call epigenetic, meaning it changes its profile depending on where it's grown. So you'll have differing levels of certain flavonoids. And these flavonoids themselves have been found to have decided effects as far as inflammation and tumor prognosis, tumor progression, tumor aggressivity. Quercetin, or quercetin, which is found in red onions and also found, where else is it found? It's found in garlic. That's been shown at the National Institutes of Health to have decided effect against what? Pancreatic cancer. And this particular study that I sent over to you was another, how would you say, flavonoid. They called it FBL03G. Okay, whatever. But it was an extract from a strain of cannabis, which was a flavonoid in composition that also had efficacy. So we're looking at different lines of effective agents, whether they're flavonoids, terpenoids, or cannabinoids. And they're all in the same plant. And so really the question will come, for this particular cancer, what would be the best strain? What would be the best terpenoid profile? Which flavonoids, which should we supplement? If we're going to go in a naturopathic approach, which wouldn't necessarily be bad. I mean, you think about it, when you first get cancer, the first thing they do is stage you to see how progressive it is, how far along it is. Well, that's time lost. That's a time when you could be being started as far as cannabis treatment, because it's not really going to interfere with anything else that's coming down the line. And very possibly you could reduce tumor burden and give the patient some relief from the stress and anxiety they obviously face when they get that kind of diagnosis.
If anybody has any questions regarding the article, I recommend you go over and do a search on Google on the Harvard study on cannabis with pancreatic cancer. You'll find a number of different articles relating to that. But I also go back to, real quickly, we're almost out of time, but real quickly recommend people going back to, and if you haven't read it or reread it if you have, the Lester Greenspoon book, Marijuana Reconsidered, because it is a personal journey with him, but one of the things that I got out of it was how it was trying to find its place in society. This is a book that was written in 1971. It was rewritten in 1978. Here we are, 2020, and we are still trying to help it find its little place in today's society. So it's a very healthy read. I recommend it greatly. Doctor, we are out of time. It goes by very, very quickly, but we always learn a lot in these within this half hour that we talk. He is the Samurai Doc. What is your website again?
The SamuraiDoc.com. Yeah.
Go there. You will find more information. You'll be able to keep in touch with him and send him an email if you have any questions. I'm sure he'll take the time to take a look at it.
SamuraiDoc@gmail.com. There
we go. Dr. Glenn Harrison, it is always a pleasure to talk to you. I look forward to these talks every week. You stay happy and healthy. We'll both try to stay out of trouble, and we'll talk next week.
You too. All right. Peace and hair grease.
The Samurai Doc was brought to you in part by
Net Health Centers, rooted in the communities of Northwest Indiana. Community Health Net Health Centers offer family practice, pediatrics, behavioral health, OBGYN, eye care, and dental. Community Health Net Health Centers provides compassionate health care for all.